Time now to bring in my good friend, Dr. Joe Congini from Akron Children's Hospital. Good morning, Joe.
Hey, Ray. How you doing today?
I'm doing real well. Nice
Good.
weather.
Great weather.
Yeah, stay safe in this high heat. But what do you got for us today?
Good to see people back out, being active and exercising. But there's a lot of recommendations about it, too. And we just 2 articles came out this week. Gosh, they're keeping our feet to the fire as far as reading new stuff. There's new stuff all the time. And 2 articles about kind of a game plan for resumption of sport after the COVID infection crisis and things like that. And there's a real kind of little-known point that I really want to bring out for your athletes, your parents, your grandparents to know about. I think everybody knows for anybody who has had a confirmed diagnosis of COVID-19, and thankfully 18 and under, that's been a smaller number, but some high school kids, some college kids, as the college athletes have resumed and come back to campus, we've seen that there's testing going on there, and we know there's kids that have tested positive. I know you heard last week 5 kids, I think, at the University of Alabama came back and tested positive. There was another school, I was on a Zoom, and I can't remember which southern school, had 7 kids come back that tested positive. So anybody that had a confirmed diagnosis of COVID-19 should definitively have a follow-up with their doctor or some medical personnel. We know that the problems related to COVID-19, to coronavirus, is that mainly issues with the lungs that we think about and talk about a lot. And so these pulmonary lung problems are changes that can be persistent, sometimes even chronic and permanent changes in the lungs. And so that's concerning and worrisome a little bit. But a lot of people aren't as aware of the changes in the heart and the cardiac changes, and there's definitely changes in the cardiac muscle that have been demonstrated in kids that have had COVID. Now, for the most part, Ray, it's been ones that have been symptomatic, but it's not always easy to tell who's been symptomatic, who's had symptoms or not. And even kids with a definitively positive that have been asymptomatic should take at least 2 or 3 weeks before they return directly to play. And then those that were symptomatic definitely need to be seen by their physician, and they may even need some heart testing or cardiac testing to make sure the heart muscle isn't involved. And the third group is those that definitely were symptomatic and those that were hospitalized because of symptoms of fever and cough and difficulty breathing and all those issues. They definitely need a workup with an echocardiogram, which looks at the movement and work of the heart, or an EKG of the heart, because this heart muscle gets inflamed. It's called myocarditis, and it's another effect of this darn virus, COVID-19, this myocarditis. And anybody that's found to have had this myocarditis really should not play sports at all for 3 to 6 months after the infection, and then they need to have workup again and exercise testing before they do return to play. So those second category where they had some symptoms but not hospitalized, and definitely the hospitalized, they've got to follow up, and they may need heart testing so we make sure they don't have this myocarditis and are sent back out onto playing fields. And so it's another real tough issue about this darn viral infection is myocarditis.
We continue to learn more and more, and still a ton of questions
yet
to be
answered. There are a ton of questions.
Sure.
And so I'm on a panel next week at a thing called Play Like a Champion today, and we'll be answering some more questions about COVID-19 in sports. My brother and I are doing a brothers team on answering questions for coaches and parents. So if anybody has interest, they can find information at my office on that.
All right. Bring some of that stuff to the table next week.
Okay.
All right. Thanks, Joe.
Sounds good, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital.